start right off with a question from the audience right here in front of you.
Good afternoon. My name is Tom Larkin. As grandparents and members of our communities, we are always concerned about the safety of our children and our grandchildren. Every day, 4 children will die from gun violence, and 2 children or teens will attempt suicide by gun. As president, what will you do to ensure that our children and grandchildren are safe and protected from gun violence?
Thank you so much for that question. Like everyone in this audience, every time we read the paper and we hear of another horrible mass shooting or a gun death in a community, it breaks our hearts. And we worry about our children and whether they'll survive their time at school. And so I care deeply about this issue. And I think if you're ever going to end gun violence, the first thing you have to do is take away the power of the NRA and the gun manufacturers. The truth is, our political system is broken. It is corroded and rotted at the center because of greed and corruption in Washington. Because government and politics is funded by money, the special interests have an outsized voice in everything. I'm the only presidential candidate who's come forward with a comprehensive approach to have clean elections, to go at the root of political corruption, to have actual publicly funded elections. Imagine if the Parkland kids had as much power as the NRA. Imagine if you, the grandparents who care so deeply, had as much power as the Koch brothers. It would change everything. So I have a comprehensive approach to do that. As president, I will do 3 things. I will ban assault rifles and large magazines. I will have a universal background check so that only people who should have access have access. And I will make sure we have a federal anti-gun trafficking law to stop the gun trafficking into communities directly into the hands of gang members and criminals.
All right. Thank you. Senator, yesterday, Vice President Biden proposed to eliminate coverage by Medicare and Medicaid for prescription drugs if the pharmaceutical company raised the price more than the cost of inflation. It's a little bit more complicated than that, but basically using the stick of the federal government to try to force pharmaceutical companies to keep the prices low. I'm wondering if you think that's a good idea. Do you think it would work?
Well, I actually would do a lot more than that. I would do 3 things to get the cost of prescription drugs down. First of all, you know, back where I started, laws are written in the dead of night by the special interests, by the drug manufacturers and their lobbyists, because they have so much money. When Medicare Part D got passed under George W. Bush, they guaranteed that Medicare could not buy in bulk to get the lowest price. Canada gets to, Mexico gets to, how come America doesn't get to? Well, under my Medicare for All plan, the first thing I'm going to do is go back to the drug manufacturers and guarantee that American citizens and anyone on Medicare gets the lowest price for every drug. Second, if we still under that have price gouging, if rates keep going up over and over every year, because I've seen it. I've seen a family whose husband was diagnosed with cancer. His medicine cost him $5,000 a month. They only had $60,000 in savings. And so this husband and wife had to decide whether or not he was going to take his medication and absorb all their savings within 1 year. He chose not to take that medication, and he didn't survive. That's what people have to decide every single day. So I will use a drug czar to use the DOJ, the SEC, the FTC, Department of Commerce, all the agencies to go after the drug manufacturers that raise prices inexplicably. I would prosecute them using the full weight of criminal justice and our Department of Justice, and I would make sure that when they do raise their rates just to make money, you saw what happened with the EpiPen, you saw what happens with biologics like Humira, you've seen it. They're bought, the rates are raised because they have virtual monopolies. So I would go after this and make sure our antitrust laws can get these prices down. And then last, fail-safe, if a drug company will not produce a generic within a reasonable amount of time, I will ask the NIH to produce that drug and provide a generic to create not-for-profit competition with the private drug companies.
Senator, you are a sponsor of something called the Stop Price Gouging Act. There are ideas about indexing prescription drug costs. Isn't that the kind of price controls that economists tell us didn't work under President Nixon and others?
No, it's not. Because under President Nixon and others, you didn't have drug companies raising the rate of a drug every year no matter what. And since that time, you've seen drug companies have exponentially higher profits. They are literally sucking money out of the healthcare system every day because they can. Our antitrust laws don't work for current day drug companies because a lot of these drug companies with their patents are virtual monopolies. I also would make it impossible and I would outlaw the use of advertising to sell drugs. To have that direct advertising is so harmful. Because if you're a patient and you've just watched this beautiful ad that they've spent billions of dollars advertising over and over again, you must have that drug. It misleads you. It is encouraging the manufacturers not to produce generics. And the fact that they manipulate our patent system to change the formula just by a little bit, maybe change how much gets released, maybe combine another medicine with it. They do it so it never has to be on generics. Can I give one example? Insulin. When the inventor of insulin created his drug, he said, this is so life-saving, I'm not even going to patent it. It has to be available to everyone. The current owner of the patent of insulin, there's still no generic. Insulin's been available for how many decades? I don't know, 30, 40 years? There's still no generic? It's an outrage. It's a life-saving drug. So as president, I would use the NIH to start producing drugs that should be generically available because they are life-saving and they've been on the market for more than a decade.
All right, thank you. Senator, you have been supporting Medicare for All since before it was cool, right? Back since
2006.
2005 to 2006. So, but what would that mean for people with private insurance? Are they kicked off private insurance by your plan? Does that happen over time? How does that work?
So I think the perfect way, so let's start with what we believe. I believe, and I'm sure everyone here believes, that healthcare should actually be a right. It should be a human right. And we fundamentally believe that already anyway, because if you're dying on the street corner, you will be taken to an emergency room, whether you can pay for it or not. Your care will be provided. So we already believe that. So I think Medicare for All is the solution because the way you get to universal coverage that's permanent, that's higher quality, and a basic human right is you let people buy into Medicare at a price they can afford. And this is really important because it creates competition with the private insurers who have to worry about their shareholder value, their high CEO pay, and quarterly profits. And unfortunately, insurance companies care more about profits than they do their patients, which is why they spend hundreds of millions of dollars lobbying Congress every year to make sure laws get written that favor them. They believe in the status quo. They don't want to guarantee health care as a right. So let people buy in at 4 or 5% of income. That will immediately create competition in the system. God bless the insurers if they want to try to compete. I doubt they will. They never have lowered their prices, and I don't believe they ever will. And over 4 to 5 years, I believe most of Americans will choose Medicare because it'll be better quality care and it will be less expensive. You need to fix Medicare if you want to build on it. A couple of ways to fix it. Make sure it covers vision and dental and ears. Make sure it covers all the disability necessities for our disability community. Make sure it covers all medically necessary. Making sure everything Medicaid covers is also covered by Medicare, so you have one complete healthcare system that covers preventive medicine, covers holistic medicine, covers everything, the gamut, integrative medicine. Then, change the reimbursement rates. Today, you ask any doctor's office, any hospital, if all your patients were Medicare, how would you do? They'd tell you today they'd go out of business. And you know why? Because Medicare or Medicaid doesn't actually pay the real cost of what the treatment or the diagnosis or the healthcare is. So make sure there's a real transparency. Those two changes, plus buying in bulk for the lowest price of drugs, is how you make Medicare possible to build on for everyone. Create your 5-year transition period, and then, after most Americans have bought in, you make it an earned benefit. You make it just like Social Security, so everyone's going to buy in at 4 or 5%, matched by your employer at 4 and 5%. And the reason why that is the best formulation is because it's permanent. Imagine someone trying to take away your Social Security. Is that possible? No. And if you bought into Medicare your whole life, you think somebody could take away your Medicare? Not possible. That's how you get to single payer. That's how you get to it as a right, not a privilege, and that's how you make it permanent.
Some of your opponents who have also proposed Medicare for All have argued that you just can't disrupt the system, that people will not want to choose to give up their private insurance if they like it. And I just want to be clear, because you didn't raise your hand during the DNC debate when they said...
It doesn't have to be illegal. Insurance doesn't have to be illegal. Let's just compete with them. Because honestly, if I had the chance of buying into Medicare at 4 or 5% of my income, I would do it in a New York minute. The only person who's not going to buy in at 4 or 5% of income are the millionaires and billionaires out there that wouldn't want to spend that much money. But if you get a buy-in by most Americans, then everyone buys in, and it's how you actually shore up the system. It's how you make it an earned benefit, just like Social Security. So the insurance industry can exist in whatever form it chooses to. I just don't think they're going to choose to compete with a better health care plan that covers everything you need, that doesn't have a profit motive, that doesn't have to take a slice of the money for their CEO pay and their quarterly profits. I just don't think they will. There's not an alignment between for-profit insurance and quality health care. It's just not aligned, because they're always going to take money out.
Senator,
Yeah.
Medicare Advantage, which a third of Medicare beneficiaries choose, is private insurance.
Right?
Medicare Part D, private insurance. Do you end private insurance for those
So
products?
you would fix Medicare so you don't need those two things. Those two things are needed because Medicare doesn't cover all the things that people want. So you'd improve Medicare and you'd make it the kind of program that wouldn't need these supplementary coverage. You want to make sure your drugs, you want to make sure your hearing, your dental, you want to make sure other treatments that you find necessary are all covered. So you have one really high quality healthcare plan. And that's why those two insurance plans are needed, because there's problems with Medicare. It's not perfect.
Social Security. Currently, there's a limit on what's taxed, $133,000 a year.
Yep.
Would you erase the cap, or would you raise the cap?
I would lower the cap. Erase it. Yeah, so a number of us are on a bill, a number of the presidential candidates, Senator Sanders and Senator Booker, I don't even know if there's a few others, but it is to start raising the rate of what you invest into Social Security at $250,000. But I have a vision for Social Security that's actually broader than that. I believe that we should figure out a way to make sure all income levels are buying into Social Security and actually improving the benefits. Because the benefits for Social Security are too low. They're very much too low for a lot of our disability community, and they're too low for a lot of seniors. So I believe that the minimum that a Social Security beneficiary, whether they're a senior or disabled, should be receiving is $1,500 a month. And that will make a lot of difference for a lot of people who are getting less than that. Because you need to make sure what you're earning is a living benefit, a living wage, a price that actually covers the things you need. And I do believe it needs to be indexed at least to reflect the cost of things. Everything that you have to buy as a senior goes up and up and up, but not your Social Security benefit. So you need to have an adjustment every year that's actually reflective of the cost of everything that you have to buy. And I would put that in place. But long term, I'd like to have perhaps a different rate, maybe even 6%, but of all income levels going in so that it makes sense. And I would also tax not just people's income buying into Social Security, but earned income. Not just earned income, but dividend income. I think dividend and earned income should be treated exactly the same because, again, the wealthy don't pay their fair share into Social Security, and they must to make sure it's viable and permanent forever.
One of the most daunting expenses that people face is the cost of long-term care. and people realize maybe too late that they haven't saved enough, and in order to have long-term care paid by Medicaid, you have to spend down all of your savings, which means you don't get to leave anything to your heirs. So I think you've said that Medicare for All should also cover long-term care benefits. How do you make that sustainable? That's a very, very expensive cost.
Right, so that's my vision ultimately is you're going to have Medicare, Social Security, and Medicaid as your social safety net for all Americans, and that all Americans buy in across their whole lifetime. Your health care may be around 4%, your retirement may be around 6%. But again, if all Americans buy in, regardless of how they get their income, regardless if it's earned income or dividend income, you're going to have such a greater base on which to build this social safety net for all Americans. And so I think you can get there. I think you can actually cover this with a more generous benefit if it is not only relegated to middle-class families and below in terms of where you contribute. So I think that ultimate contribution by all income is necessary. And I think if you do it that way, there'll be enough resources to create that social safety net for everyone.
Does Medicaid get folded into Medicare for All?
Eventually. I mean, ideally, if you really can realize this vision, you're going to have one healthcare program that's good for everyone, that you're going to get not only economies of scale with, but you're going to get lower prescription drug prices because you're going to mandate it and guarantee it, and you're going to cover the things that people need. And that is who we are as a nation. And unfortunately, we just haven't dreamed big enough for the last 30, 40 years. We actually just haven't had a vision for what it means to have every person in our communities thrive. We don't have affordable housing in this country. We don't have enough job training, so people who want to be working, for anybody who wants to be working in the workplace, there's not the right job training to get them into those jobs. And this is the kind of investments that need to be made. And when you take the cost of healthcare off the table and you take the cost of retirement off the table because you've all invested it over your whole lives, it's going to free up a lot more resources to create a growing economy so we can thrive longer.
Your family Bill of Rights includes a plank for paid family leave.
Yep.
For people who have a family member who is suffering from dementia, temporary leave isn't going to solve that problem.
Right.
How do you solve that?
Yeah. So I have an idea, and I've not fully fleshed it out, but I will share it. We've had a debate in the Democratic Party about universal basic income. And I didn't love that idea because I think there's such a dignity in work that people really want to be working. Most people would love to have a higher paying job. Underemployment in this country is so significant. But related, I thought, what about all the people in this country who are working full-time, but they're working as a caregiver full-time? Think of all the spouses who have to give up job opportunities and give up an income because their husband or wife is incapacitated, because they can't earn a living, and they have to meet that need at home because they can't afford a home health aide. They can't afford outside care. So how about this? How about considering anyone who's doing full-time care, who's working full-time caring for a loved one in their family, get that universal basic income, that they're actually eligible for the same Social Security benefit that someone who's disabled is eligible for. And if you make that benefit at minimum be $1,500, that is enough of a living wage to get you out of the poverty line, so that you as working full-time in care are getting the basic necessities, the basic amount of money you need to survive. Because families that don't have this, I can tell you, I met with a woman yesterday who struggles because she was trained to be a paralegal. She wanted to increase her income, but both of her children had disabilities. One child had schizophrenia, and another child had a severe learning disability, and she had to care for her kids because they couldn't work and she couldn't now work, and they're living on one family member's fixed income. They couldn't afford it. So she is spending her life working. She should be actually paid. It is so better for her to be doing that work than to have to pay through Medicaid and through Social Security, other social services to do that work, which will be far more expensive. And imagine if the community then has to take these young kids and through their life have them institutionalized because they can't be cared for at home. The outcomes for those kids are not going to be as good, Because you know every person who wants to age in place, every person who wants to be cared for in the home, they thrive, they actually do better. So this is a much better idea. So I'll be fleshing that idea out over the weeks to come.
Related to what you just said, there's a shortage of direct care workers in this country, especially in rural areas in Iowa. How do you build up the workforce of people in nursing homes, for people who need in-home care? And would you consider, excuse me, at age, I'm going to choke up. You answer. No.
I got the answer. I know the question. I got it. So how do you deal with the fact that we have the baby boomers aging, and a lot of them might actually need 24/7 care? I mean, Alzheimer's alone is going to create a need for 24/7 care for a lot of our seniors. So I want to deal with your workforce question and then answer a related question. So 2 ideas to improve our workforce. First, national public service. Ask every young person in America who's willing to serve a year in public service, they can have 2 years of community college or state school free. If you're willing to serve 2 years, you get 4 years free. And then you open up the definition of national public service to the industries where we're desperate for young workers, one of them being healthcare. So imagine giving a young person the opportunity to see what it's like to be a healthcare worker, so you can inspire more of them to actually become home health aides, to become nurses, to become doctors, to become assistants. All of that matters. First of all, if you want more people to go into that industry, you need to pay them more. Our home health aides earn less than the minimum wage. You have to guarantee every worker in America gets at least $15 minimum wage, indexed to inflation, so it's a real living wage. Second idea, besides national public service, is guaranteed job training for anyone underemployed or unemployed. Now, this is a real issue in Iowa because you have a low unemployment rate but a very high underemployment rate. So why not use those same community college programs and state schools and apprenticeship programs to teach young people to go into, and not just young people, mid-career people who feel deeply underemployed, to go into the healthcare industries where there's going to be a great need, and we're going to have the skills training to get you into the job that's available in your community. So at least those 2 issues.
Sorry about that. That took me by surprise. I just wanted to ask, though, would you consider allowing H-1B visas for people who want to be engaged in direct care?
Direct care jobs. In terms of our immigration reform?
Right.
Yeah, so comprehensive immigration reform with a pathway to citizenship is also an enormous economic opportunity. Because the truth is, you have 12 million people arguably here who are being paid perhaps less than the minimum wage, perhaps working in the shadows. And so if you create this pathway to citizenship, you can move everyone out of the shadows, being able to have a path to citizenship. During that 10-year path, we would ask anyone seeking to become a citizen to pay their taxes, pay into Social Security, pay into healthcare, pay into the local property taxes, pay their fair share for the 10 years you're here, and then if you've done everything right, you can earn your path to citizenship. That alone would create an enormous investment into Social Security, into our tax base, and into our economy. And yes, they could do the same job training over time to meet needs that are unmet. But if they come out of the shadows, then we will realize the industries that still need workers and really help our young kids and people underemployed into the industries that are desperate to hire more workers.
Senator, I think this will be the last question. And in case you didn't notice, she's a New York senator. So this next question references something in New York. There's a group of anchor women for a news channel in New York who've sued, and they're alleging age and gender discrimination at the workplace. Why isn't that a bigger issue, age discrimination in the women's movement?
Age discrimination is real. We look at society and we recognize that women aren't valued. Just ask a woman over 65 how valued she feels. She might be disregarded because she's a woman. She might be disregarded because she's a woman of color. She might be disregarded because she's an older woman or an older woman of color. And that's just the truth. And so it is a huge issue, and I'm glad that they are suing because I think discrimination is real. And I will fight against discrimination in every form because I'm someone who's fought for women's voices for the entire 12 years I've been in public service, not only taking on the Pentagon and sexual violence, but college campuses and Congress. I will continue to do that to lift up all voices. And that's why I'm running for President of the United States, because I think you need a president who will take on the fights that no one else will.
Senator?